Street Journal. So let's see how they spin this one. Let's see how they spin this one. This is going to be great. As COVID-19 flares anew in Britain, the U.S. watches for a possible new surge. So real quick. Okay. So Delta and Omicron variants have tended to strike Europe before reaching America. Here's what the data show on whether that is likely to happen again. Now, again, the wild type variant as well came from Europe. Like how we originally got COVID in this country was from European flights. So that's important to understand. But so let's keep going. The recent rise in COVID-19 cases in the UK has U.S. health experts watching closely. Now, again, the White House says we're out of money. Fourth shots are only going to be for certain people. Otherwise, you have to pay for them. The uninsured are now going to have to pay for COVID treatment. The U.S. said, everyone take your mask off. Everyone get back to work. Right? The U.S. CDC changed the way that we count COVID deaths and hospitalizations and cases. They changed the way that we count transmission risk. Again, the United States is committing a genocide. That needs to be understood. 1 million people. Personally, the number is going to be more. It's got to be more. I mean, look at excess deaths, right? Like the way the reporting is, and now they're covering up cases and stuff. Like the data. I don't trust the data anymore. I stopped trusting the data, honestly, when Trump started saying that he wanted to mess with it. Right? Like the data is a number, right? 1 million people dead from COVID. I'm more likely to believe it's like maybe 1.3 million. I would assume, based on everything I've seen, excess deaths, calculations, that stuff, right? There's no contact tracing at all. There's no PPE production. Companies are price gouging. If you want a mask, you have to pay like 5 times what you would pay in like February of 2020 or January of 2020. 10 times something. So I need to say that. I need to underscore that. We are living through a genocide. A historical genocide. This isn't like the 1918 flu. This isn't like, oh, we don't know what's going on. We're not prepared. We don't have the science. We don't have the medicine. We don't have the communications technology to be able to give people information on how to... This isn't the 1918 pandemic. This is... Everyone on Earth can talk to each other instantly. With this fucking phone, I can call someone in China and they can answer the phone and we can have a real-time fucking conversation. Right? We have experts in the fields of medicine and science that somehow managed to develop these vaccines in record time. Right? We've got the ability, supply chains built to have people stay at home. We've got postal services to deliver products that are necessary. Again, with the homeless problem, right? Like, we've got hotels. We saw during the pandemic, people that were homeless were given shelter in hotels to help reduce COVID transmission. But then they just sent them back on the street, right? So what we are seeing is a purposeful neglect of anyone who would possibly be at risk, right? Again, the CDC is like, oh, good news. Only people with comorbidities will die. Meanwhile, 80% of Americans have a comorbidity. I like, this is like, if you manage to live 30 years in the future, 40 years in the future, right? I know I'm going to be talking about this for the rest of my life, right? I'm going to be 80 years old, doing Above It All, episode 19,600,400,903.6. And I'm going to be talking about the fucking great genocide of 2020s. You know, who knows how long this is going to last. Because that's what this should be referred to as. This is a genocide. The COVID-19 genocide. Right? The governments all across the world have collectively decided the immunocompromised don't matter. Fuck them. The elderly don't matter. Look at what China did with Hong Kong and like the current outbreaks going on there. The elderly didn't get vaccinated. They're like, fuck it, whatever. And now with this fourth wave, China has now had the worst outbreak since the pandemic started with this new wave. right? With Omicron and Delta, that was like what broke Vietnam. All these countries that are like, oh, they were at COVID zero. New Zealand was destroyed by Omicron, right? But who's dying mostly in China? The elderly, right? So again, this is like, who's dying mostly in the United States? Disproportionately people of color. Why? Because people of color often have to do more service jobs, or they're more closely around other people. You know, white people, for example, are more like, hey, look where I'm at. I'm working from home, right? So white people are disproportionately more likely to be able to work from home, to have lower transmission risk. Minorities, people are more likely to be working in fast food service jobs, are more likely to be around other people, which means they disproportionately get COVID, which means they disproportionately die of COVID. And you know what? The government says that's fine. The government's like, oh, the blacks are dying. That's the government. They don't give a fuck. They're actively promoting policies that are going to result in the deaths of significant portions of these populations. The immunocompromised, they're fucked. They're fucked. The CDC, the Biden administration, the Trump administration, they're like, they got together. They're like, all right, how can we kill all the disabled people? Oh, I know. Let's just do nothing about this whole COVID thing. That backfired, because guess what? People that get long COVID, they're going to be disabled for the rest of their lives. There's teenagers out there that got COVID in like March of 2020, and they still don't have the ability to taste or smell. That's fucking scary. Healthy, quote unquote, people that are like 16, 17, and now 2 years later, they can't taste, they can't smell because they've got long COVID. That's fucking scary. This is all by design. We've had 2 years to prepare for this shit. We've had 2 years to get contact tracing. We've had 2 years to get like extra stimulus funding. We've had 2 years to fund supply chains. We had 2 years to get protective equipment. 2 years to get universal masks. And the best we got is 8 rapid tests. Rapid tests that have like a 50-50 like positive, like, you know, 50-50 what's the rate? Like false positive rate or something, or false negative rate. We got 8 tests. That's what the government gave us. And a vaccine that wanes over time. And not everyone's taking the vaccine. And so the pandemic's not ending. And now they're going to start charging us for the vaccines. So I need people to understand. This is genocide. This is not, oh, what are you going to do? This is not, oh, why did it have to be this way? This is purposeful. This is by design. Now, again, I know it's a little bit of a conspiratorial thing here, and I'm not trying to say, you know, I'm not getting into the plandemic garbage, but what I'm saying is, like, again, the numbers are in. We know how to stop this pandemic. Lockdowns, universal masking, universal vaccination. We know the solution. The antidote is right there. It's like if someone has an allergic reaction and the EpiPen is in their pocket, and you have the EpiPen in your hand, you reach in the pocket, you get it, it's in your hand, and then you do nothing, and then they die. Well, you have the solution. It's right there. You can use it anytime, and you chose not to. Hey, I didn't kill him. I just decided I didn't feel like saving their life, even though it took no effort. That's what this country's doing. Again, Delta variant comes around. Kamala Harris gave this big interview with the LA Times. She was like, no idea. We had no idea. Delta variant totally blindsided us. They didn't see it coming. Kamala Harris, the vice president of the United States, said, the second variant, we had no idea. Totally didn't see it coming. But then the third variant comes, and it's like, again, fool me once, shame on you. Fool me twice, you ain't gonna fool me again. Unless you're Kamala Harris. Omicron comes around, she got fooled again. Now we have Omicron 2, BA2. Again, there's no other Greek alphabet letter because the people that name them were like, we don't want to scare people. This is already 1/3 of new cases in the US, by the way. But they don't want to scare people, so we're not going to call it like fucking Epsilon or whatever the fuck. I don't know what else. The rapid spread of the highly transmissible BA2 Omicron variant and an easing of measures aimed at slowing transmission, such as mask requirements, are causing problems in Europe, according to epidemiologists and physicians. The U.S. has also broadly dropped mitigation measures, and federal authorities estimate BA2 represents about 35% of U.S. cases. Those factors are raising concerns that the U.S. could experience another COVID-19 surge. Fourth wave. Let's strap up. Does anyone want to start placing bets, by the way, on how many fucking surges there's going to be? Because I'm going to place my bets on 69. There's going to be 69 surges. That's my guess. Our experience with Delta and Omicron is that what happens with Europe doesn't stay in Europe. It hits us, said Jay Varma, a physician and epidemiologist who directs Weill Cornell Medicine Center for Pandemic Prevention and Response. As you can tell here, this is supposed to be tracking the UK in black and the US. As you can see, there's usually like a week or two kind of delay, and the numbers aren't identical, right? You know, different countries and all, but the typical trends of the thing you're looking at there. The 7-day average for cases in the US is currently hovering around 31,000, the lowest level since last July. Now again, since last July. Well, let's look at the way COVID data is tracked. Since last July? Well, we know if you do an at-home test, you don't count. And we know that the administration is promoting at-home tests. And we know that the funding for testing and testing facilities has gone down. And we know that, again, there was this quote-unquote mandate, the Biden mandate, that was either get vaccinated or don't. And the don't option is you get tested once a week, right? And that's government funded or whatever, right? That's not happening anymore. People aren't getting tested. They might get sick. They might take an at-home test. So again, I want to be very clear. Since last July, this is not the same formulas being used for the numbers since last July. And I'm starting to feel like I'm starting to feel like I'm getting into like the conspiracy fucking Alex Jones territory, but I'm watching it in real time. Like, we're just looking at what's happening in real fucking time. Like, the CDC announces like 4 times in between last July and now that they're changing how metrics and formulas are working. And then the media isn't reporting that. They're not telling us. Oh, it's just like, oh yeah, it's, you know, comparable to last... Yeah. My God, case counts in both the US and UK don't reflect the true number of infections, and testing levels have historically been higher in the UK. Well, that's a little bit of a good thing. I just want to say that. That's good. Health experts say the US has faced a significant challenge tracking cases because of its rise in at-home testing, which generally isn't captured in state counts, and some states have dialed back on the frequency of their reporting. Okay, so I'm glad that they actually brought that up a little bit. Whether U.S. cases will start climbing once again following the UK trends remains to be seen, public health experts say. Some factors could help the U.S. avoid widespread surges, including BA2's acceleration in the early spring, when people in cold weather areas such as the Northeast are starting to spend more time outdoors. I feel like I'm in Groundhog Day or Twilight Zone. This is what happened. Remember in like 2020, right? March and April. February, March, and April, people are like, oh, the spring's coming, summer. Once summer comes, COVID's going to get burned away. It's going to dry up and disappear. Does anyone remember that? And then there was a surge in the summer because everyone in Florida was going on spring break, bro. We're going to go get wasted. Woo! Right? And they were doing that whole thing. And then everyone got fucked up. Right? And then in California, people are doing like the fucking weird protest, like all the fucking, oh, so cringe. Right? Okay, so that didn't end up happening. So then 2021 comes around, right? And people are like, oh, well, the vaccine's out. You know, people are going to get vaccinated. Summertime. Hot girl summer. Woo! And then Delta variant's like, so about that. But now here we are again. Third time's the charm, right? Maybe this time. Maybe, right? Maybe. Some people are saying, many people are saying that when the spring comes around, COVID's going to go away. It's going to disappear from the warm weather. Hasn't happened yet. But many people are saying. So, I mean, I don't know, man. This also makes no sense because what about countries that are in the other fucking side of the globe where it is summer already. Like, where it is hot already. Like in Brazil, for example. Right? Like, I mean, these people are just... This conspiracy theory that somehow the warm weather is going to be what kills COVID is like that. It's anti-vax tier. It's the same. It's like it's Trump QAnon tier, except that conspiracy theory somehow is able to get into the mainstream media somehow. Like the ivermectin stuff, that's all banned and this should be banned. But maybe the warm weather, bro. Somehow that's not in the same category. It should be. My God, man. Centers for Disease Control and Prevention Director Michelle Walensky said Wednesday that reported COVID cases have declined sharply on the national level, but infections have edged slightly higher. Interesting. In New York State, including in New York City in the past week, some places in New England have reported that more people in the hospital with COVID-19. She said specifically in areas where the CDC estimates that BA2 now accounts for overall half of cases. This small increase in cases in the Northeast is something that we are closely watching. This small increase in cases. I want to remind everyone, thousands are dying every single day. Statistically, when people get COVID, they might have long COVID. It's a small case. It's a small increase. The downplaying of this shit is reprehensible. It's reprehensible. It's mild. Remember that Omicron's mild. Where did that come from? That came from your boss. That came from the fucking corporations. They told everyone, let's just pretend Omicron's mild. There was literally no scientific evidence. There was no study linked. They made it up out of whole cloth. And then I hear like people in my family say like, well, I heard Omicron's supposed to be more mild, so I'm not that worried. They just made it up. And then 1 million people a day got infected. 3,000 people a day were dying. 9/11 every day. This was just 2 months ago. This was 3 months ago. It started. But 2 months ago it ended. This isn't 10 years ago. This isn't 30 years ago. This is 2 months ago. Are people this stupid? Are Americans this fucking stupid? That 2 months ago has just disappeared from their fucking memories? Like, I mean, I smoke a lot of weed. I'm high right now. So sometimes I deal with short-term memory loss, right? But the idea of just forgetting that 1 million people a day were getting infected and that there was a 9/11 every day in this country for like, I don't know, a month and a half straight, and this was 2 months ago? What the fuck? Like, what? And everyone's just like, oh yeah, it's mild. There are still people that talk about, oh yeah, it's mild. It's mild, bro. Mild as fuck. The less vaccinated population in the U.S. is a potential risk factor. I love that. The less vaccinated. The fucking snowflake fucking crybabies got their like fucking politically correct fucking term. No, I'm not an anti-vaxxer. I'm a less vaccinated population. Okay, sure. This includes people who are eligible for booster shots, which have shown to help protect against severe illness and death. The U.S. experienced higher rates of COVID-19 deaths per 100,000 people compared with the U.K. during the Delta and Omicron surges. Hospitalizations in the two countries haven't followed the same trajectories. Now again, please note that the U.K. typically has a better health system. While hospitalizations have risen in the UK recently, the number of patients requiring ventilators hasn't increased at the same pace. The UK also has a much better rate of vaccination. Counts of newly admitted COVID-19 patients in U.S. hospitals are at their lowest recorded level after any prior surge. The 7-day average for newly admitted confirmed cases slid to 1,836 on Wednesday, down from a record that reached 22,000 in January. A Wall Street Journal analysis of the federal data shows. Now again, keep in mind, the way that data is being tracked, I just don't trust these numbers. I don't. But also, people are likely not to go to the hospital. People, especially if they're uninsured, and COVID funding for people that are uninsured is being reported in the news. Oh, if you're uninsured, don't go to the hospital. I'm just saying, there's a lot of factors here. The prevalence of BA2 in the UK reached 69% for sequence samples from Feb 27 to March 6. While BA2 hasn't been found in a majority of cases in the US, the CDC on Tuesday estimated that the variant has accounted for more than 50% of cases in parts of the Northeast, aka parts that are further like up on the timeline, essentially. The Northeast, you know, hub of transport, international transport, right? People fly from New York to London all the time, right? So that kind of stuff. Okay, those states are among many that recently lifted masking mandates. So again, all the restrictions, what little restrictions that there were, because again, masking mandate doesn't mean you have to wear a mask or go to jail. It should mean that. That's the ideal scenario, but it doesn't. It means, oh, maybe wear a mask, maybe. We'd like you to when you're inside. And then when you go inside a store, everyone's too afraid to tell you to put a mask on because they don't want to be on fucking your Instagram feed, you know, when you like fucking go to jail for beating the shit out of someone, right? Like, hey, going into the grocery store, right? You have a greeter, they say hello. Shouldn't they also say, hey, put your mask on? Especially when there's free masks. Like at the grocery stores that I would go to, there's free masks at the door. People would look at them and laugh and then walk in without a mask on. So, again, these so-called mask mandates, if they're not enforced, they don't mean anything, right? So, I just want to be very clear. The restrictions that we had already, horrible. Horrible. Not even remotely sufficient. Like maybe 2% what we need. And then, now we're back down at 0. I don't know, man. I don't know, man. Like, this is all, like, I don't know what to tell you. I don't know. I don't know what to tell you. This is fucking crazy. This is crazy that we're still dealing with this. This is crazy. Like, I want to go to concerts. I'm going to go to a restaurant. I want to go to a movie theater. Without fucking fearing for my life. And then also, like, imagine if I did get COVID because I went to a concert. Right? And then I'm going to have to live with the fact that if only I didn't go to that fucking concert, then I'm going to have trauma associated with the fucking concert that I went to. Right? So it's like, I mean, I love gambling. I love cryptocurrency. I love gambling. But this is ridiculous, man. This is ridiculous. This country, this world and this country. My God. Ride the waves, bro.